This is Dr. 𝐢𝐧𝐟𝐞𝐫𝐭𝐢𥥬. I'm a consultant infertility specialist in Thamra Hospital and IVF Center, Rajajinagar. So today we are going to discuss with the male part of the infertility, that is what is the male factor involved in the fertility aspect as such, because always we generally tend to focus more on the female. That is what was done from the previous, and now yes, it is we are focusing on the male because we are seeing there's a lot of variation in the male factors which is affecting, because initial 5 years or 10 years back, yes, there was definitely less reason or less possibility of male factor was involved because there was not much of stress or much of lifestyle changes was involved. So now there was only the chances of 30% of the reason the male factor was involved for the infertility case. But as per the today's, that is I'm talking about 2022, so as we see now the ratio has increased to almost 50%. That is, the probability of infertility due to the male factor is almost about 50%. So there are many factors involved. That is, whenever the couple comes to us, so when we see the female factor, that is with her hormonal analysis, next we see the male factor where we see the semen analysis. So in the semen analysis, there are certain scenarios where we see the semen analysis. That is, what are the things we see in the semen analysis? What we see is the first is the volume, which is very much important. The normal volume is between around 0.5 ml to 1 ml. Then we see the liquefaction factor. Then we see the sperm count. So the sperm count, which is really matters, because as and when the years are passing around, so the guidelines have changed. So as per the WHO guidelines, the normal sperm count as present is around 15 to 20 million. So initially it was like 30 to 40, now it has come down to 15 to 20. And we see the morphology, that is what is the normal sperms, then that is should be around 4%. That is the indicated according to the guidelines. And we see the motility factors, we see the rapid progressive motility at least around 40%. So this is the normal thing what we see in the semen analysis. So but as per now, we are seeing the lot of men with the counts which is completely nil or which is in a lower aspect, that is oligospermia or azoospermia. Then we see is the motility which is in the lower side, that is if the count is normal, we are seeing that the motility is completely zero. So why motility is important? That is what everybody asks. So the motility, what does it do? The fast moving sperms, what we see is very much important, because the more faster and the aggressive is there, the fertility chances increase more than around 20 to 30%. So the DNA fragmentation, the motility factors and the morphologies, all these three go towards side to side. So which are very much important in a sperm quality and the quantity. So suppose if the couple comes to us and the husband is having some of the other factors of problem in the semen sample, that is maybe a morphology or the motility. So normally we ask their background, that is we see that whether he is working any kind of strenuous activity or the stress activities, and any lifestyle factors like whether they are he was smoking and alcohol, because all these factors will definitely affect the sperm quality also. So if at all the person is following any of these things, that is his smoking or he's alcoholic, yes, generally tell them that you need to quit all these factors so that it will definitely help it. Then the second thing is, if he is not doing any kind, because nowadays we are seeing out of 5 or 6 men who are not doing any kind of smoking or drinks or anything, but still their sperm is not of a good quality. That is, the morphology won't be good, the motility won't be good, the count is also in a lesser aspect. So this one again we can say that because the way we are living the lifestyle, again I'll come back to that, because many of them men are doing in a sedentary lifestyle, I can say, so that they are not walking around, they don't have time for exercise, they don't have time for taking care of their own body. So it is more basically on a sitting way and doing the things. So because of this, we are seeing that many of the men's sample is coming down, and we see called as there will be a veins dilatation. So when there is a vein dilatation, there will be obstruction of the sperm and the quality and the morphology deteriorates. So normally what we do is, in case if at all they have all this kind of a features, we get a scanning done, and if the scrotal scan shows that yes, the veins are dilated, then the next thing is we see where they stand. That is, it is in a too much worse stage, that is stage 3 or 4 or stage 1 or 2. So suppose if it is stage 1 or 2 with little bit of changes in their motility and morphology, then we give them with vitamin tablets. That is, we give them amino acids, we give them lycopene substance, zinc, all these things which help in the motility and morphology. We see them for 3 months. Then once after 3 months everything is good, it is improving in a better way, then okay, we will let them to trying for a natural basis. Suppose it is not happening, there is no improvisation in the sperm quality or the quantity, then the husband has to involve in the procedure, like kind of a TISA or for an IVF, because sperm is very much important for the embryo formation, for the quality of the pregnancy, as the DNA happens through them. So if the sperm is not in a good quality, definitely the embryo quality gets deteriorated, and that is the reason present day we are seeing a lot of pregnancies which are happening even in IVF or even in a natural pregnancy. We see that early pregnancy loss, that is at the initial stage at 6 weeks or 7 weeks, we seeing that pregnancy will happen, the heartbeat doesn't come, or if the heartbeat does come, we seeing that at 3rd month or 4th month there's a lot of anomalous baby. So these are the factors which will definitely affect if at all there is a deterioration in the sperm quality. So it is better the couples who are trying for the conceiving should go for a semen analysis along with the woman who she is going into any kind of test, and if the semen analysis is in a not a good way, so it is better to consult the infertility specialist, so that the gynecologist or the specialist is going to guide you to see how you go through it, and followed with that you can have a better results in future for the conceiving also.